wanted to say something, but she was in a
They're
hurry.
actually testing it? Yeah.
Yeah, so they're
Well,
actually
this is not
testing it
as
and making
probably
sure it
intense.
works. You're
Yeah.
right. It's not as in demand as the label.
Cumbersome.
Right. 8:41, let's go over to the Guam Memorial Hospital with Administrator Lillian Posadas. Good morning, Lillian. Thanks for joining us.
Good morning, Chris. Good morning, Sabrina.
Good morning.
Guam.
It's been a while.
Yeah, we just
Good
get right into it. This is something we're talking about with Dr. Maglotnia from Public Health, and asking you about there was a 12-year-old boy who had passed. We had got the tip that it was from COVID. I had asked you. You said it wasn't COVID, but then you told us that the child was treated in the COVID care unit, and then we also had got some tips that the death certificate had said COVID, and I spoke to the doctor who we had heard signed off on the cause of death yesterday. He informed me that it was resolved, and I'm assuming that we have changed the death certificate, which, when we talked to Dr. Maglotnia yesterday at Public Health, she did say that wasn't entirely uncommon, that type of thing has been done before. But, I mean, it just seems, especially, feeling for the family, I mean, imagine them being told it's COVID, then it's not COVID. I can't even imagine what they're going through. So I really wanted to bring you on. And I thank you for coming on because, I mean, you actually called me to sort all this out. So can we do that, Lillian?
Sure, absolutely.
Okay, so go ahead. Just take us to the beginning.
Okay, yeah. From the beginning where you texted me that you received a tip that a 12-year-old boy passed away and it was COVID, and I responded that it wasn't, because it wasn't. The child was admitted. Initially, he was seen at GRMC, transferred over here because of the symptoms he was exhibiting, fever. And so the GRMC took a swab specimen, and we tested it here via the Abbott ID Now device that we have. And we received the result as negative. But, we wanted to make sure, so we did another test. We did another swab the following day per the doctor's order. And also that specimen was sent to Public Health PCR. Both tests came back negative. So 3 tests, showed that he did not have COVID. But, again, in making sure that we just continue to exercise precaution, we moved the individual. First of all, we admitted him to the pediatric unit. But then, to exercise all precautionary measures, and especially because, that was a pediatric unit, there were other pediatric patients. We want to make sure that we, contain, if he does have COVID, we contain that spread of infection and not, bring it over to the other pediatric patients. So we moved him. We moved the 12-year-old to the COVID care unit 3, which is, again, on the 4th floor, but, on the other side of the wing. And so we kept him isolated, and we exercised all the abundance of precaution to make sure that we protect also the staff. And, we just, also instructed the family that the parents, they can visit, but we made sure that they also don the protective, gear. And so, we managed his care. Unfortunately, his condition continued to deteriorate because his condition was really of a serious heart condition. And so, and unfortunately, Saturday night was when we lost him. And yes, the initial, the death certificate worksheet that the doctor had filled out, because, again, we were still thinking it's probable COVID, but that was not really the cause of death. The cause of death was because of his heart failure, the serious heart condition that he had. And so that's why, we in discussing it with the other physicians that were taking care of him, we all came to the agreement that the cause of death was not COVID. The kid did not have COVID. We were just exercising all the precautions.
Right. So at no point, Lillian, did this boy test positive for COVID-19? No, never?
No, at no point about did any of the Abbott tests or PCR tests come back positive. It was all negative.
And how would you explain to the public the death certificate thing? And are you able to tell us what what did it say about COVID in that? What did you call it? A worksheet?
Well, whenever a patient passes away, the physician, the attending physician, fills out a death certificate worksheet. That worksheet then gets transmitted over to public health to then, put it on an official death certificate record that Vital Statistics prepares. And so the worksheet is a GMH document, and it gets, transmitted over to public health, and public health puts it on a formal death certificate document. That death certificate document, it's not, I think in certain states, it is viewed as a public document, and other people can request for it. But I think Guam law, it's not a public document. It's requested by, I guess, family. Relatives and families can request for it. So I don't think that Guam law recognizes a death certificate as a public document.
So, Lillian, what has the family said throughout this time? Because I can't imagine, and especially you guys were treating it like COVID because it was isolated. The family had to don the PPEs.
Sure.
So how did you reconcile that with the family going from where we'd heard they thought it was COVID. Some even said they were told it was COVID, and then it wasn't. So how did that work out in discussing that with the family?
I can't say because I did not have access to the family. I did not have direct communication or, again, access to the family. But, they're grieving, they're hurting. And so we need to respect that. They lost a child. And that, for any parents, for anybody, that's painful to endure. And so we want to respect that. But in terms of, being informed that, he has COVID, again, it's probable that he may have had it prior to coming to the hospital.
Why would you say that, though, Lillian, if he tested negative 3 times?
Well, I understand that he was sick prior to coming to the hospital. So, again, we were exercising precautions as much as we possibly can to make sure that it does it to protect the employees and to protect other people. Right. And so, I mean, that's the nature of how we handle patients who may have COVID.
Right. Mm-hmm. So at any time, were there any antibodies of the virus that were detected in the boy? Yes.
The doctor also ordered a serological antibody testing, and that was validated by the DLS lab in Hawaii that he had IgG. IgG is the antibody that, when a person is infected with the COVID coronavirus, the IgG is produced by the body, the antibodies. And so, yes, he had the serological test, and yes, he had IgG in his system. So it may be an indication that he had COVID prior to coming to the hospital. So.
But am I just not asking right? Because I thought I asked you if he had any time tested positive for COVID-19, and you just said no. So maybe you can explain that better.
Chris, if you listen,
okay.
The test that we run to test for COVID is the Abbott test and the PCR. IgG is not a test of COVID. It's a test of antibodies.
Okay.
Which would indicate whether or not they may have had COVID in the past?
They may have passed COVID, coronavirus infection.
Which would, I guess, for the physicians who were watching this child, was the PCR done prior to him being moved to the COVID care unit?
I don't know exactly when they did the Abbott and the PCR test, because
the serology test.
Again, I don't know the date that the test was done.
Right.
The doctor ordered. I don't know exactly when it was done.
So, Lillian, is it can you say if he had the COVID antibodies, was COVID in any way a contributing factor to the boys passing? Because you can see the optics of it, right? Especially for us lay people who aren't hospital administrators or doctors, our understanding of this, maybe it's not where yours is, but if we're hearing that he tested negative, but that there was the IgG where the COVID antibodies were there, I mean, doesn't that mean that his body was fighting COVID?
No, he's recovered from COVID. He's past the COVID. It's an indication that it's a past COVID condition. So again, it's not the cause of death. The cause of death was his heart condition, not COVID.
So again, so we're clear, the serology test only will it show an indication whether or not somebody has recovered from COVID, has had it in the past, whereas the PCR...
That's what the serology test indicates, that there are antibodies in a person's system.
Mm-hmm. And the PCR would determine whether or not they have COVID currently.
The PCR will be the one that's testing if there is a present COVID condition, infection.
Mm-hmm.
So if I got the IgG and you guys found COVID antibodies in me, the determination would then be that I had COVID, not that I have it.
Most probably that you had COVID and you've recovered from it.
Right.
Can we go back to how common is it to change a death certificate worksheet?
It's again, I'm not a physician, but it's not like Dr. Maglonia said, it's not an uncommon. Especially if they do an autopsy and they find other situations that may not have been visible at the time of death, but an autopsy can confirm something. So then, therefore, that death certificate can be changed.
Right. And so, as far as now that with the death certificate, it has been changed, right?
It is reflecting heart failure.
Okay. So that.
So it was changed.
Yes, it is.
And it was changed because the initial certificate or initial worksheet said that he passed away from COVID.
Right, and it's not.
Okay.
That's not true. That's not accurate.
Okay.
He did not pass away because of COVID.
Mm-hmm.
All right. Well, I want to thank you for
clearing that up
for us. I mean, are you clear on that, Bree?
Yeah, I'm clear.
Okay, Lillian, can we get an update on the hospital? How are you guys doing? And I heard something, I wasn't sure, I was probably going to send a FOIA, but was there an emergency procurement that you guys did for like a computer program or something?
It's not an emergency procurement. We have been in the process of, upgrading our electronic health record system, our EHR. Yeah. That we've been talking about. We've been letting people know that we need to upgrade it because the current system that we have is getting sunsetted. It's going to be phased out. So we need to make sure that we have, the computer system, computer hardware, the computer software, peopleware. We need to make sure we move along with getting people trained for the system. So it's not so much an emergency procurement. It's an ongoing. We've been doing this, and so I don't know what information you heard that there's an emergency procurement.
Lily, you know how it is when you hear, you don't know if you don't ask, right? So.
Well, yeah. So I honestly don't.
I mean, how many times have I asked you a question and you've been like, "Where the hell did you hear that, Chris? What? Federal authorities, huh?" I didn't see where the hell you're going. It's like my grandma said, if you're shy, you don't try, so I'm just trying.
Yeah, but, we are procuring some stuff for our electronic health system, and that includes computerware, software.
Mm-hmm.
Okay.
We haven't heard a lot. It's been because of everything that's happened with COVID, but the Army Corps of Engineers report, what is the status of that?
Well, it got final. It's in the website, and the Board of Trustees, we talked about it, in fact, last week at the board meeting. Some of the senators have been given a copy of it per their request, but it is a public document now that it's a final report. And so, based on what, it's basically essentially the same as what they had when they did the exit conference back in November. The many things that this facility needs to be repaired and replaced, such as the leaking roof, the HVAC system, the electrical panel, the envelope system of the hospital where the windows are leaking, the computer system, there's exhaust, the exhaust that needs to be repaired or replaced. So, basically what we pretty much know have been problematic and have been requesting for capital improvement funding to get these, repaired and replaced. It's essentially all in that Army Corps report, and that's available.
Was there any sort of recommendation like we just need a new hospital?
They did. They recommended two things. They recommended a new hospital at a certain price of $743 million. They recommended fixing, all that needs to be fixed at a price of $761 million. So, it doesn't take a rocket scientist, right? Scientists might as well spend that $700 million to build a new hospital.
Mm-hmm.
And so that's the direction that the governor is leading, is that we need to build a new hospital. But in the meantime, we still need to operate this facility, because building a new hospital takes 5-7 years. And so we still need to continue the operations, and we still need to make sure that the care we provide patients is in a safe facility.
Right. What about is there a transition, Lillian? GMH is the COVID hospital now that, it kind of, is COVID over? Are we transitioning from that?
COVID is not over, Chris, and I don't think it's going to be over. It's in our community. So we need to continue to exercise, diligence and be cognizant and continue the measures that have been put into effect as far as social distancing, masks, and hand washing. It's not over. COVID is not over.
But
I'm sorry, but I think that's the fact. It's just not over.
I agree.
So when
What was that?
I was going to ask if the governor lifts her public health state of emergency. I think it's ongoing until the 30th of June. Say she lifts it at that point, are we going to stop the non-COVID hospital agreement with GRMC?
No, I don't think so, because we continue to, we continue to have people come in and treat them as possible COVID, so we run the test on them. GRMC does the same thing when they accept patients into the emergency room with symptoms of fever or any other associated symptoms with COVID. They also do a specimen swab, and then they refer them over to GMH. But we are in this. We continue to. We're a hospital. We can't. We just have to continue treating every patient that comes through who needs medical attention as potential possible PUI, and and run the test. And if they are negative, which will be a good sign, then we just admit them as regular patients, not COVID patients.
How key has it been for you guys to have your own testing capabilities at the hospital, Lillian?
It's great. It helps with the flow and making the decision, quicker. So they don't have to wait in a COVID unit, waiting for the results for a day or 2 days for public health to give us the results. We get the results in 30 minutes, and so it gives us a clear direction that, okay, this patient can go to medical surgical, this patient can go to telemetry. We don't have to have them wait in the Care 1 unit.
Do you have the status of the grandfather and the grandson who tested positive?
No, I don't, because they're no longer in our facility. They're no longer in our care, in our authority, in our responsibility. So they were discharged to the government-sponsored isolation facility.
Mm-hmm. And you said how many COVID care units are at GMH?
Well, we have the first one, which we opened up, which is our former urgent care unit. That was the first COVID care unit that, when we were receiving patients who are PUI, that has a capacity of 5 exam rooms. One of them is a complete isolation room that we had, that was structured to be the Ebola isolation room. So that's one area. Adjacent to it is the Care Unit 2, COVID Care Unit 2, which is also between ER and ICU. We've upgraded that to the capacity of intensive care units. If a COVID patient comes in and needs an ICU level of care on a ventilator, it's right close to the ICU between ER. So that's Care 2. On the 4th floor, the old pediatric unit, it's actually a 20-some, about 20 bed capacity on that 4th floor. That's our COVID Care 3 unit. So the whole area, it's 17 beds. We can accommodate, 17 individuals with COVID and keep them contained and isolated.
Mm-hmm. How many people do you have in each of the units?
Well, the maximum capacity for the Care 1 is 5. Maximum in Care 2 is 5 also. And then on the Tier 3, maximum capacity 17. We still also have the 5th, the COVID isolation facility, which is our skilled nursing facility in Barragata Heights.
Mm-hmm.
That's another extension for more of a downgrade level of COVID individuals who still need to be in an isolation situation, but are not able to go home yet because their home is not, adequate to continue the isolation measures.
So how many are in COVID 1?
COVID 1, that's Care 1, that's 5 beds.
Yeah, how many
COVID 2,
people?
No, none right now.
Okay.
We don't have any COVID patients right now.
So we
No
don't have
COVID,
any,
okay.
no hospitalizations.
No COVID patients in
okay.
the house.
Lillian, I'm just starting to get some messages from some of my medical friends. So I kind of want to go back to this. Boy, just if you could maybe address, one writes, the way we approach our cases is, would this person still have passed if it wasn't for X, Y, and Z? And so I guess my question to you is, we detected the presence of antibodies in the boy. So do you think he would have passed from his condition if he hadn't been infected with the virus?
Oh, I can't say that because I don't have all the facts, all the data on this child, other than he came in with a high fever and with a heart condition, serious heart condition.
Mm-hmm. Was an autopsy conducted?
No, autopsy was not conducted because it was here for more than 24 hours.
Mm-hmm.
If he was here for less than 24 hours, then that becomes a coroner's case, a CAB case. And so, yes, an autopsy would have been done.
Mm-hmm. And just for clarification, when I asked about the COVID care units and whether or not there were any patients in any of them, are there any probable cases?
No, not even that. They were brought into ER, but they were tested, and the test came back negative. So we have 7 individuals in the emergency room waiting to be for an inpatient bed.
Lillian, have there been any other death certificates that reflected COVID that were later changed after the fact for whatever reason?
No, none at all. Because the 5 that have passed were definitely COVID because the tests were positive.
Mm-hmm.
The COVID tests, the PCR tests, and the Abbott were positive. And at that time, we weren't doing IgG serological antibody testing at that time.
I know last we spoke, you had mentioned that GMH had received, I think it was $12 million in federal funds, CARES funds.
11.5.
11.5. Has all that been expended already? And have you received any additional funds?
No, we haven't. But I just want to clarify that of that 11.5, 4.5 was really an advance. It was an advance. They call it advance Medicare payment, meaning Medicare gave it to us in advance of claims that we're going to submit for Medicare patients. And so that's really kind of like a loan. They give you an advance payment, and so we may have to pay that back.
I see.
So we're reserving that as not counting. I made a mistake of counting that in the total of 11.5, but those are funds that we received. So yeah.
So have you received any other additional, I guess, federal grants or anything like that?
Not recently, not this week, and not last week. So total, we have received $7 million, and yes, we have expended, some of those funds already.
Mm-hmm. And I know you were mentioning that you were working on chillers, right, or something like that for the
working on what?
SNU. You mentioned that you guys were working on. Was it chillers or something like that?
The chiller.
Yeah.
The chiller at SNU, right, to keep the facility air conditioned.
Right. And the elevators are fixed. And
all the elevators are working.
Okay.
Wow.
Yes.
And then we have amended, I thought I saw something about amended visiting hours.
We have, modified visiting hours.
There you go.
We are allowing 1 family member per patient for the time period of 5 p.m. to 8 p.m. And, they alternate. They can rotate, but they all have to kind of wait outside of the facility because we don't want, again, congregating in the lobby. We want to make sure that we follow the social distancing. So other family members, immediate family members, will just have to wait outside, and then they take turns going up and seeing their loved ones.
All right. Lillian, anything in closing you want to add before we let you go?
Well, just again, for everybody to continue the measures of, containing and prevention of further transmission of this infection, because it's insidious. We don't know who's got it. So we just have to make sure we follow the social distancing, wear your mask, wash your hands, and if you don't have a sink and a soap, then use hand sanitizers.
Okay.
Lillian, have you been out to dine in, or you don't really seem
No,
like you're in a hurry to dine in with what you're saying?
I like to, yes, I like to. My husband and I would like to go out, but I haven't had time. And my husband does the cooking, so we don't go anywhere.
All right.
Yeah.
Okay.
All right. Take care, Lynn.
Take it easy, Lillian. Wash your hands.
Take care.
Okay.
Yes, wash your hands and stay safe.
Got
Okay,
it.
you too.
All righty. Bye-bye.
Bye.
907. Yeah. So thank you again to Lillian for providing that insight. Did you feel that it was? I want to kind of take what she said and then maybe run it by some I don't know, doctors.
Yeah.
907. We'll take a short break and we're back with more of the KUAM News takeover of Guam's favorite. It is containing COVID. Good morning.